Alan, contact tracing is simple in theory. You track down the people who have had contact with someone who's just been diagnosed with COVID-19 and make sure they isolate and get tested. But now the I-team uncovers tracing trouble in data showing the process is often frozen by people who won't pick up the phone.
I have a lot of family members that were affected with the virus, and then I have a lot of fellow friends that died from the virus.
Delfino Vargas says he's lost 4 friends to COVID-19, people in their 30s. Now he's becoming a contact tracer to help those here in his hard-hit back of the yards neighborhood.
I wanted to make an impact in the community.
Unfortunately, our neighborhood and our culture is more susceptible to this virus, and we're suffering from that right now.
The Back of the Yards Neighborhood Council is among 31 community-based organizations hiring contact tracers across the city. 600 total, building the new Chicago COVID contact tracing core by reaching those most impacted by the virus.
When you look at the devastating effects that the pandemic has had on African American and Latinx communities, not only through the disease but through the dislocation of employed people, this really seemed like a great opportunity to get community involvement and engagement to not only help stem the transmission of the disease, but to also create job opportunity.
Contact tracers fight COVID-19 by calling those who test positive and asking for their close contacts. Then they'll contact those people and ask them to get tested and isolate, trying to track the disease and stop further spread. The problem is many public health officials say people aren't picking up the phone when contact tracers call, meaning missed opportunities to stop the virus in its tracks. New Illinois Department of Public Health data analyzed by the I-team reveals that suburban Cook County is reaching the smallest percentage of COVID-19 cases statewide, only 9% of positive cases interviewed by contact tracers. In Chicago, state data from August 1st to October 24th shows contact tracers only interviewed 30% of cases. Additional city data obtained by the I-team through the Freedom of Information Act reveals that Chicago contact tracers tried to reach nearly 40,000 people, both those who are infected and their close contacts, since the start of the pandemic through mid-September, but only reached 17,000. That means nearly 60% of all calls attempting to reach people diagnosed with or potentially exposed to COVID-19 failed.
There's a sizable portion who we just aren't able to reach.
Chicago Department of Public Health officials say as of mid-September, they reach 83% of all who test positive within 24 hours.
When public health calls you, you have an opportunity to protect yourself and your community by working with us. This is the opportunity to act. It's the opportunity to cut off the next exposure and kind of prevent that spread from continuing.
In DuPage County, data obtained by the I-team via FOIA indicates more than 16,000 unsuccessful calls, 3,500 people unreached during the pandemic. According to IDPH data from August 1st to October 24th, DuPage health officials reached 70% of all positive cases. Successful case contact varies widely across the Chicago area, from reaching just 53% in Will County to 73% in Kane County.
We're a data-driven community here in Kane County. The biggest challenge we face is people picking up their phone.
Public health experts stress that contact tracers never share your private information with other agencies. They don't even tell contacts whose numbers you provide that you're the person who tested positive. We have more analysis and an interactive map of contact tracing success rates across the state on our website, ABC7Chicago.com.
Hey, if you like that video, be sure to subscribe to our ABC7 Chicago YouTube channel.